You're seeing clinicians playing key roles in supply chain teams. You're seeing physicians actually leading supply chain teams. And a lot of this, again, is because of the value-based care environment, the evidence-based data, the young professionals, the need for data. I think if one thing COVID pointed out to us is we thought we had good data. No, we have a lot of data. We don't know how to take that data and turn it into actionable information.
Without supplies, there's no surgery. Without products, there's no patient care. Welcome to Power Supply, the healthcare supply chain podcast focused on helping you navigate the intricacies of logistics, purchasing, contracting, and supplier relationships. Each episode, we speak with healthcare executives, supply chain leaders, and innovative entrepreneurs from across the country as they share their stories, experience, and expertise on the industry we love. From the loading dock to strategic sourcing, from buyers to the C-suite, and across the enterprise, we tackle the real-life issues impacting the healthcare supply chain. Whether you're tuning in for conversation or inspiration, we're glad you're here. You're just in time to hear it from the source and stock up on insight. So sit back and plug into Power Supply.
This week on Power Supply, we speak with Mike Schiller, Senior Director at AHRMM, and Brian Bartel, Director of Materials Management at McKenzie-Willamette Medical Center, and also the Chair of the Education Committee for AHRMM. And Gary, today we're going to be talking with these two gentlemen about their strategic vision for the future, a lot around what they have planned for education for AHRMM membership, but we're also going to review some of the resources that our members really should be taking advantage of, and also encourage those of you that are not our members to take advantage of joining. And then we're going to be talking also about their strategic overview. So these two gentlemen have been a terrific resource and also huge supporters of our Power Supply podcast since we just launched in April. Just can't say enough about how appreciative I am of their early feedback on the work we're doing here.
Yeah, Mike and Brian have been great supporters of us. I'm really looking forward to hear their patient-centered focus with the cost, quality, and outcomes and how they tie that into our listeners who are listening to this podcast and how to use AHRMM and be successful in their supply chain marathon, if you will, moving forward. So I'm really excited to see what they have. Tons of experience with Mike on his end, obviously well known, and Brian as well. He's been heavily involved in AHRMM and has had a very successful career with supply chain. So looking forward to it. I think it's going to be educational and really kind of help support as we move forward with some opportunities for those that, understanding more about AHRMM.
Yeah, certainly we'll be talking a lot about AHRMM, but stay with us until the end because we're going to pick their brain on what they think are the key areas to be on the lookout for as we move into the future as supply chain leaders across the country. We'll be right back with Mike Schiller and Brian Bartel.
I'm Hayes Walder.
This is Gary Skinner.
And I'm Justin Poulin.
A production of 17 Studios, you're listening to Power Supply.
Joining us now is Mike Schiller, Senior Director at the Association for Healthcare Resource and Materials Management, and I think every listener to this podcast knows we will adoringly refer to that as AHRMM. And then we also have Brian Bartel, Director of Materials Management at McKenzie-Willamette Medical Center, and also the Chair of the Education Committee for AHRMM. And I just want to thank both of you gentlemen for not only coming on the podcast today, but for also taking an interest. We only launched in June, and you've been listeners, and I just can't tell you how grateful I am for the support and the feedback on the podcast endeavor so far. So let's start with Mike. Mike, thanks for coming on the show. Why don't you tell the audience, I can't imagine they're not familiar with you already, but why don't you tell them a little bit about your background?
Who doesn't know Mike? Come on, everybody knows Mike. If not, they will here shortly.
Mike. Hey guys, thanks so much. Appreciate the opportunity to join you today and talk a little bit about what we're doing here. So really quickly, my background is in supply chain, 30 plus years as a supply chain professional. Prior to joining AHRMM, I worked at Lurie Children's for 17 years in various supply chain and technology roles. At AHRMM, my role is the subject matter expert for our association as well as for the American Hospital Association. And I help work with our leadership in setting a number of strategic initiatives for both AHRMM and the AHA. So again, a great pleasure to be here with you guys.
Excellent. And then we'll go over to Brian. And Brian, we're really excited because you're the chair of the education committee. And, we really view this podcast as an educational endeavor. And I think you happen to know Gary. So if you want to tell us some crazy stories about Gary, I just wanted to know you have free reign on this podcast. It's relaxed. It's maybe educational, but it's also fun. Welcome to the show. And why don't you tell us a little bit about yourself as well?
Absolutely. Thank you, guys. It's a pleasure to be here. Gary, we'll save some of those stories for later. But been in the healthcare supply chain for a little over 10 years, been a member of AHRMM for almost all of that. Super excited to be here, kind of tell you a little bit what AHRMM's doing, some of the things that we're working on in the future. But again, I just thank you guys from the Power Supply team. Very much enjoy all of the podcasts that you guys are putting out. And I'm just super excited to be here.
Well, I'm excited to talk about what AHRMM has planned for the future, and specifically educationally, but also strategically. I think everybody has been paying a lot of attention to the CQO movement, cost, quality, and outcomes. And I think no more than the environment we're in today are those just hitting right home in terms of what we all need to be focusing on to kind of survive what I would say is a very unique time in supply chain. And so at the same time, we're also seeing lots of differentiation and a lot more sophistication in supply chain healthcare as well. So with that being said, Mike, why don't you just give us a strategic overview for AHRMM, as we move forward in kind of a new world?
Sure. Well, let me just level set. CQO, cost, quality, and outcomes, is an initiative that AHRMM launched, really signifying the role, the intersection that the supply chain professional sits at each of those three factors, or each of those three pillars. And it really moves beyond the cost only perspective that we've held in supply chain for so many years, where cost will always remain an important component, but cost must be looked at in the context of quality of product, quality of outcomes, patient experience, as well as the financial reimbursement realized by improving those patient outcomes. To just kind of put it into a picture, if you will, in the past, it was the supply that was at the center of the wheel. It's now the patient that's at the center. Everything focuses around the patient. From CQO, we've moved to a natural evolution of CQO to the clinically integrated supply chain, which really speaks to supply chain collaborating with physicians and clinicians, bringing evidence-based data to the table so that we can look at the outcomes of various devices, various products in the patient populations that we manage as hospitals.
Yeah, I think, when you start to see the emergence of strategic sourcing, it's really going right into what you're talking about there. Also, as we talk about developing community, because I think, we've had to really lean on a virtual world. I believe this was also in the works too, but I'm going to kind of start with this healthcare learning community and have you tell us about that. But also, there's a lot of new positions as a result of the emergence of strategic sourcing. And so we have a lot of new blood coming into the industry. A lot of people are also having to emerge into leadership roles. So I know that as we first start with this healthcare learning community, we're going to go right into those other key points as well, because, the talent for the future is a big part of AHRMM's mission as well, I'm sure.
Absolutely. And just to kind of wrap up the thought on CQO, it really comes down to operating in today's value-based care environment. It's no longer a volume-based environment. It's a value-based care environment that is looking at the outcomes. And so that being said, the healthcare learning community is our opportunity to address common challenges that we see across the healthcare field and to bring a group of diverse and key stakeholders around the table so that we come together as a cohesive group with the voices represented by those key stakeholder groups to come up with a common solution as opposed to each organization or each stakeholder group coming up with their own solution to that challenge. So these collaborative solutions and recommended practices, we are able to craft these and then get these out to the healthcare field for adoption.
And so how do you kind of support this leadership piece and then also newer or younger professionals that are coming into the industry?
The key component here is really how can AHRMM educate and equip today's supply chain professionals to become tomorrow's supply chain leaders. And it's about delivering this education, delivering these leading practices. I tend to steer away from the term best practice because that's a short shelf life, right? So by bringing together these key stakeholders, we're able to develop these leading practices that we can share with the healthcare field, with supply chain professionals. And our focus is, if you look at our membership, it spans a wide range of supply chain professionals. We have very tenured professionals, and we have those professionals who are just coming into the healthcare supply chain. So our education has to span that breadth of expertise. And by developing these recommended practices through the healthcare learning community model, we're able to bring those different voices around the table to ensure that the education we're delivering speaks to all of those voices at one time.
So leaping off of that, you have this Young Professionals Advisory Council. So I think a big part of it is also engaging, that audience, just like you were saying, and it has to be a really broad audience. So you're hearing from, new members maybe of AHRMM or professionals that are new to supply chain. They don't necessarily have to be new grads either. They could be coming from other industries, I would assume. And then you're getting that feedback. But I would think that their insight is also extremely valuable to long tenured folks that are working in supply chain as well, because kind of knowing what new professionals are looking for as recruiting is just becoming, such a big emphasis. I mean, we know that there's this workforce shortage in general that is on the horizon. So I think, culture and really making sure you understand, what the new professionals are looking for in their careers. I got to think this advisory council is a huge help for that.
It's a huge help. And really, one of the things that AHRMM, I think, can really deliver is because we have that broad breadth of expertise, we have the tenured professionals that can act as mentors to the young professionals, but we also have the energy and the new ideas from the young professionals that can reinvigorate some of the practices that, as a tenured professional, you tend to just stay in that swim lane. So I think it's a great dynamic. And, Justin, you talked a little bit earlier about some of the new roles that are coming around or coming about or being incorporated into the supply chain. And if you look at the young professionals, and you look at the emphasis on technology and data analytics, data management, you're seeing roles such as data scientists in the supply chain department. If you would have told me 10 years ago that there'd be data scientists in supply chain, I'd say no way, right? You're seeing that. You're seeing clinicians playing key roles in supply chain teams. You're seeing physicians actually leading supply chain teams. And a lot of this, again, is because of the value-based care environment, the evidence-based data, the young professionals, the need for data. I think if one thing COVID pointed out to us is we thought we had good data. No, we have a lot of data. We don't know how to take that data and turn it into actionable information.
Well, Mike, I really appreciate, first of all, your comment. I was taking some notes here. I had patient-centered focus, like right in the middle of the nucleus, the axon dendrite, whatever you want to call it. I really love that you brought that up. I'm all about mission. So really appreciate your comments on that. One of the things, too, about AHRMM that, we've got Brian here on the podcast as well. I've known Brian. We've worked in the past. I know he has an amazing future, an amazing brain that I've been able to tap into and learn from him too. So, but Brian, you've got some direction on the education committee of AHRMM, and maybe speak to where that's going with AHRMM and kind of supporting Mike's comments first on the strategic and then moving into the education piece.
Yeah, so the education portion of AHRMM is absolutely fantastic. One thing that Mike's kind of alluded to as well, AHRMM really draws in a diverse crowd. So we've got people like myself that sit in supply chain. We've got people on the clinical side. We've got vendors. And then, of course, we've got the GPOs who all help kind of accumulate the need for education that we have in the industry as a whole. And so the other portion that I think is very important with AHRMM is that it really is a member-driven organization. So there's various different committees. Again, I've been fortunate to be a part of the education committee for a few years now, heading that up as the chair of the education committee this year in tandem with Mike. We've got some very exciting things coming out, but that kind of member-driven focus really allows us to draw in these diverse ideas and accumulate that information into things that's actionable in today's world. And as you look at COVID, like Mike was saying before, there's been so many changes, things that we thought we had a good grasp on that we don't. And again, at the end of the day, supply chain's role is to support our clinical counterparts, making sure that they have the products and supplies that they need to take care of our patients. Those patients could be you, me, our families, and just anybody in our community. So it is very relevant. But a lot of very cool things that are coming out through the education committee. We've got a new badge program coming out. I'm a big fan of LinkedIn and different things that you can do to elevate yourself. That badge program is going to be very, I think, intriguing for people because it allows you to take certain courses, online presentations, however we're going to structure that, and then be able to share that through social media. So very exciting things. And again, just the breadth of experience, whether you're brand new in the healthcare supply chain or whether you've been in the supply chain for 10 years, there's more than likely more than one topic out on the education portal through AHRMM that you would find interesting and that could help you on a day-to-day basis.
Hey, Brian, when do you expect that to be kind of up and running through LinkedIn and other platforms? I think that's fascinating.
The badge program, is that right, Hayes?
Yeah.
It's the wave of the future. I mean, you're seeing it pop up everywhere. People can almost like specialize in certain areas, right? And kind of take that education in chunks. Is that right, Brian?
That's correct. So we're working on that right now. I'll kind of defer to Mike on the actual time frame for that. Right now, we're putting together foundations to inventory management and a foundations to procurement. Those are the two that we're focusing on right now.
And going off script here a little bit, guys, obviously everybody here has known the importance of supply chain for forever. But isn't it kind of cool in the last 2 years, year and a half, how much supply chain has gotten so much more movement, so much more visibility inside these systems, and the importance and how so many people have a seat at the table that they never did before?
Yeah, that's a great point, Hayes. We were viewed and have been viewed for decades as the department next to the morgue in the basement, right? Move the boxes,
so true.
Stock the shelves, order the product. And I think in today's COVID has really highlighted the strategic need for a supply chain, for a robust, for a resilient supply chain. And that's part of what we're trying to do through the healthcare learning community as well is what does a reimagined healthcare supply chain look like with these new roles? So it's really emphasized the importance not only of healthcare supply chain, but look at where we're at 18 months later, right? We're looking at logistic channel constraints, the ports, labor shortages that are affecting deliveries, right? OTR and last mile deliveries. We're looking at other raw material shortages like aluminum, semiconductors, resins. These are different business sectors. These are raw materials that affect a number of these different supply chains, but also affect healthcare supply chain. So the need for the supply chain professional, supply chain leader of the future, the next gen supply chain leader, they really have to have a global acumen on supply chain, a global supply chain, right? Looking at these raw materials and how that could potentially affect your healthcare supply chain and then being able to have that visibility and respond accordingly.
And how that one ship in the Suez Canal can back up everything, right?
Right.
I mean, it's so all interconnected. And it's been really fascinating to see how supply chain in general has been amplified in the last 18 months.
I think something else that's been magnified, is just and I think the micro credentialing badge program is really on point with this, but we have to look at different ways to engage members, right? And audiences in all professional trade organizations. It's been harder and harder to meet in person, although I got to commend you all for getting your conference off because so many were canceled around it. And I had a really good time. It was nice to see people in person again, but I know what an enormous amount of effort went into that and the regional chapters. And so creating lots of ways for people to get value from the professional trade organizations to get education and looking at creative ways, for delivering that education. That badge program is just one example. But Brian, I kind of thought maybe you could talk a little bit more about what you've seen from the educational committee standpoint as like, what if people requested because they used to go, maybe do an event once a quarter, once a month, and see educational presentations and network. And we almost have to redefine that whole experience, don't we?
I think that you're spot on with that. And again, with the education portal through AHRMM, you have a lot of individual ways that you can learn on your own. There's on-demand learning activities out there that you can choose and pick from. I've taken those. I've got some in my shopping cart right now that you can go out and take those whenever you want. In terms of how things have changed, you're right. Unfortunately, I wasn't able to go to the AHRMM conference this year, but I did attend the virtual conference last year. And out of all the virtual conferences I've ever attended, AHRMM by far, hands down, the best. And again, I really do attribute that to the information that AHRMM is able to provide in tandem with GPOs, vendors, and again, the supply chain throughout the healthcare industry.
You know, I love bringing people onto these shows because I have my CMRP. I've been a member of AHRMM for quite a while, but I think we often miss the value that's being provided sometimes as we get caught up in our really busy days. And so anything that we can do to just continue to educate and inform our audience, who many of them, I am quite certain, are members of AHRMM, just to talk about the value of membership and to ensure that they're aware of all the content and information that's coming out. So, Mike, we can start with you, but either one of you can kind of color in all the details here. But what are some of the, more important highlights around membership that you really want to make sure that everybody in the audience is taking advantage of right now?
Well, I think there's a number of different advantages and benefits. The education, to Brian's point, what he's talked about is key. And I think that these foundation courses, this micro-credentialing that we're incorporating into our educational content is exciting and is moving in the direction that we see the field moving, that we see our members wanting, right? So we're addressing their needs on that educational side. Networking is critical. The ability to interact with your peers. And again, looking at that expansive expertise that is represented across AHRMM's 3,600 plus members, the ability to interact and talk and understand, here's the challenge I'm facing. Hey, Brian, what are you guys seeing? How are you addressing this? So just the opportunity to network beyond these virtual sessions that we have or beyond social media groups or the interface that you have with your phone. So that's another key benefit that AHRMM brings to the table.
And a couple of things just being in the healthcare supply chain through COVID and even before that. But I really, really enjoy the AHRMM Connect. It's their online forum. And so anybody that's a member is able to go in, post questions, have that conversation back and forth. You get everything from, hey, we're experiencing a back order of product XYZ versus, hey, we're trying to pull it, extensive reports through our MMI system, which is such and such. And those conversations are happening on a daily basis. So somebody can post it and you can come back a couple hours later and see responses. It's an awesome way for people to be able to get help throughout the healthcare industry. And again, there's vendors, there's different people from other organizations that are on there giving kind of their own ideas. So rather than reinvent the wheel, you're getting information from other people.
Another benefit is our weekly e-news blasts that we send out, the emailing that we send out. And we're really looking to refresh that and to make that much more encompassing. So one of the things that AHRMM has taken on during the course of the COVID pandemic is curating content across a number of different media outlets and taking out the items that are going to be most relevant, impactful to our members, and then putting those into either our COVID update or COVID-19 updates that come out 2 or 3 times a week, and our weekly e-news. So we want to be able to deliver more of this global perspective to our supply chain professionals, making them aware of some other elements or factors that could be impacting the supply chain. So I think that it's really important that that's great information that you get and have access to as a member.
My question came back to both Mike and Brian earlier was, are these forums specific? I know you mentioned the clinical side, Brian, the GPO side, supply chain side, but are those forums specific to each individual? Are there carve-outs or is it the generic? For those who maybe have not dove into it before, what can they expect when they see that forum or even the knowledge center?
So it's a great question, Gary. The forum is open for everybody. There's one forum. You'll go in, you'll see all of the pending conversations that are out there happening. You'll go in if you want to place a new question or whatever it is that you want to know. You'll put in a title and then everybody has access. There's no segregation between vendors, healthcare providers, and GPOs. It's all open, which I think is a really neat way to do it. Yeah, very transparent, and it allows everybody to comment on the same things.
Yeah, and it encourages the partnership.
For sure.
Absolutely.
It makes it collaborative. I guess to Brian, to your point, it pulls in everybody, leaving it open-ended and not saying, you know what, we're siloed here, we're siloed here, we're siloed here. It's the whole thing, Brian. We're trying to sell a piece of capital equipment to the hospital. Can't just go down materials management, not include IS or biomed or clinical engineering. It's the same situation. The inclusivity is what I keep hearing. I guess that's the word I was trying to get to earlier, is inclusivity is what I'm hearing from AHRMM, and the direction and the micro-credentialing, I think, is really, really good. I'm excited to hear what you guys have been saying. So thank you.
And guys, I want to add another thing about just the benefit that just keep coming to my mind as we're talking through this. So AHRMM being the association for the supply chain professional, we have the ability to interact with a number of regulatory agencies, and that has increased during the course of the COVID pandemic. So our ability to bring the voice of the supply chain professional to these meetings, as well as bringing information coming from these meetings with different regulatory agencies back to our members, is critical. It's a critical connection that AHRMM is able to broker.
Hey, Mike, that's a good point you just brought up, because I'm interested, and obviously AHRMM does a lot of fantastic things. Obviously, all the things we've just discussed about the trade shows and the content and information. What type of resources do you have for the community? In other words, how many employees work behind the scenes to make all this stuff work? I'd be curious. I think everybody would be interested in that.
That's a great question, Hayes. And I think people will fall out of their chair when they hear that there's 6 people on staff that make this all happen. 6 people. And we've got
6.
support from 2 marketing people. We have a centralized marketing team within AHA. And 2 of those people support AHRMM, as well as some of the other professional membership groups within the AHA, but 6 dedicated AHRMM staff.
My hat's off to all 6 of them. They do a fantastic job, and well done. Good job.
Well, I'll just say it right there. It's a great utilization of resources. Well done. All right. So we're coming close to the end of the interview, but we'll definitely give you an opportunity to add anything, but I kind of want to throw a couple of questions at you just to have a little bit of fun and let you, kind of spread your wings a little bit in the conversation. Cause I know we've been really focused, on AHRMM, but as you talk to the members out there, what are some of the biggest topics that are coming, on the horizon? Not necessarily what we're living with right now. And I know it's kind of what we're living with right now is definitely setting the table for that part of the conversation. You mentioned global awareness, global supply chain, even sourcing strategies are going to have to adjust, and understanding raw materials. Like those are real things today. But what should people really, especially if they're new to this industry and they're looking out, for another 30 years in their career, what should they really be paying attention to that's on the horizon that will help them develop a skill set to be prepared for more challenges that will be coming in the future?
That's a great question. I would say labor shortages. I know you talked about maybe not necessarily today, but labor shortages are, while we're experiencing that today, that's going to be an issue for some time to come. And the reason being is you've got the Amazons and now Walmart and other supply chain industries who are raising the salary of these individuals, offering some significant money, $18, $20 an hour in some cases, to entry-level supply chain staff, warehousing staff. And if you think of hospitals as they continue to grow in size, a number of them are opening up their own consolidated service centers, right? Their own distribution centers to support their operations. So we're all competing after this finite resource. And so, the salary piece and these other industries that are going after those very same resources, I think labor challenges or labor shortages will continue to be an issue moving into the future.
Mike, I was just going to agree with you. And another thing with the COVID vaccinations.
Yes.
I mean, that is creating the tap onto the labor shortage on top of it too. So I was just going to add to you, Mike, that's probably a whole nother discussion, but I know you know that too. And I just wanted to bring it up as another valid point.
That's the can of worms that creates the second podcast in this podcast. But you're right, Gary. I mean, there's a lot of, not just on the supply chain side, although I do know somebody who was a casualty of that very recently, who forwarded their resume over and said, can you help me, find another job? And interestingly, and very crazy, is they included a letter from their direct supervisor that was a glowing report of their capability and performance. And so, but then we start going out, the clinicians, technicians in sterile processing, surgical techs, even the ones that are supporting, surgical services that are the biggest revenue generator in the hospital. There are major casualties, as a result of their reluctance to get
EBS
vaccinated.
To food nutrition across the
Absolutely.
board. It's across the board, and it all affects supply chain. Yep.
Yeah.
So.
In fact, I read this morning, guys, that some hospitals are looking to suspend terminating employees because of the vaccine mandate, just for the very reasons you're talking about. You have such high burnout, 18 months that we've all been at this, right? And the burnout is real. And you've got people, clinicians, done. Supply chain professionals, done. So you've got a reduced workforce coupled with a labor shortage, and now the potential that you're going to terminate people because they're not being vaccinated. It's a perfect storm from a labor perspective. And not only just healthcare. Think of truck drivers, right?
Oh,
think of all of the other industries that support all of the various supply chains across all the different business sectors represented out there.
I think you're right on, Mike. When you brought that up, the labor shortage, I think that is a ongoing dialogue and probably another podcast in itself, Justin and Hayes and team.
Oh, I am just the person. I've done it on one of our sister podcasts from MZ, which is, sort of a workforce economists and modeling company. And they have I'll just give them a plug if anybody's, this really sparked their interest, but Beer with MZ is a really great channel of theirs on YouTube. And they do a really nice job of creating content and also putting some interesting information around workforce out in front of us. All right. Last question before we wrap. And it's basically the same one, but I'm going to pose it over to you, Brian. As you look into the future, and I'm not necessarily saying you've got this magic crystal ball, but as you look into the future, what are some areas that, supply chain professionals, be it they leaders today or are planning on growing into leadership roles, what is something that they really need to keep their eyes on? Maybe a potential blind spot that's not getting enough attention that they should start to research and grow their knowledge base so that they are more prepared for what's coming down the pike.
Absolutely. Great question. In my humble opinion, transparency and resiliency, two words that we've probably overused in the last 18 months, but it's really true. I mean, when you talk about the healthcare supply chain, we are at the very end of that. The clinicians are at the very end, and I guess the patients, for that matter, are at the ultimate end of that. But we've been living in a world up until recently where it's been just in time, where we rely on our distributors to have the product for us. That's caught a lot of people off guard. And so we need to have better visibility into the upstream supply chain. I've had numerous conversations over the past few months with our vendor suppliers, our distributors, giving us detailed information about what they're seeing at the ports, what they're seeing with trucking shortages, what they're seeing with rail, things that we've never had conversations with. And that needs to continue. The other thing that I would really emphasize too is the need for data analytics and technology. It's amazing because healthcare has so many amazing things that save people's lives and make them better every single day. But when you look at the supply chain, I've walked into organizations that are managing millions of dollars of inventory with clipboards, writing things down on pieces of paper. And so we've got a long ways to go in a lot of different aspects as far as technology and utilizing what Mike had said earlier, getting that data into something that's actionable. I think that there's a huge opportunity for healthcare supply chain to take that data and move it into something that's actionable, that really does help reduce the cost of care, that helps with the cost, quality, and outcomes, and ultimately has better patient outcomes.
Not long ago, we did an interview on interoperability. And so when you talk about that resiliency and having good quality data in the data sets, we really can't get to that end-to-end connectivity without transparency. Well, I should say we won't get to that end-to-end component that allows us to be resilient without that transparency and that clean data, as you were talking about, Mike. So really great point there.
Yeah. And a couple of things I want to go ahead and add to that question. It's about reducing our risk. We have so much exposure to risk in our healthcare supply chains because we tend to aggregate our purchases under sole source agreements, and we move everything to a single manufacturer. So we need to look at reducing our risk exposure in the healthcare supply chain. We need to look to moving to more of a demand forecasting model as opposed to the historical, this is what I've used in the past. Let me base my par level inventory on this. How do we get to that demand forecasting model as best as we can in a healthcare environment, as dynamic as that environment is? And lastly, I'd say foundationally, this starts with data standards, guys. We need to start incorporating and adopting data standards in our item masters. We need to look at the UDI. We need to look at GLN. We need to look at other data standards and nomenclature so that we all begin to call the product by the same name to get to the point that Brian made, that visibility, that transparency, that utilization. Burn rate was a huge term you heard a year ago. What's your burn rate? Very difficult to tell if I'm calling the same product 6 different names or have it listed by 6 different catalog numbers. So you need that standardized nomenclature, that those data standards and that UDI. That's foundational. That helps us to build upon all the things that Brian had just mentioned, as well as the demand planning and other
We'll
factors.
have to get Karen Conway on here to talk about UDI.
Yeah.
I saw her speak, I want to say 6 or 7 years ago in State College, and I wound up contributing to an article with her for Healthcare Purchasing News about UDI and some of the implications, in some of the other departments. We know how important it is to supply chain, but, again, in surgical services. And so super important one. So maybe I'll have you make a reintroduction to Karen for me. We'll get her on here to talk about UDI. Gentlemen, we've got to wrap, but this was phenomenal. And I do very much want to reinforce to all of our listeners to be sure, especially if they are members of AHRMM, to take advantage of the value, the resources, and be on the lookout for a lot of creative opportunities coming down the line for education. And then if you're not an AHRMM member, I would encourage you to become one and to begin taking advantage of those resources as well. You both did a fantastic job. So thank you so much for coming on today.
Thank you, Justin. Again, a great opportunity.
That was Mike Schiller, Senior Director at AHRMM, and Brian Bartel, Director of Materials Management at Mackenzie-Willamette Medical Center and the Chair of the Education Committee for AHRMM. And Hayes, lots of great points in this interview. Just, really fantastic way to promote the value of being a member in professional trade organizations in general. But for our audience in supply chain, AHRMM has got so many resources on the website as a member. He mentioned the weekly updates that come through the newsletter and just all kinds of things. And it was one of the very few conferences that I was able to attend in person this year. They really pulled it off without a hitch during, pretty challenging times. And Hayes, that event was right in your backyard there in Tennessee, based in Nashville, for this year's AHRMM event. It was a good time. It was good to see and reconnect with a lot of people. So I appreciate what Mike and Brian are doing to really take supply chain into the future and providing resources to this community that is only going to continue to grow as specialization continues within supply chain.
Totally agree. 100% agree. AHRMM is a great platform for all people, from the beginners to the guys who've been in this business for decades, and they bring all kinds of wonderful resources and guidance. So I learned a ton. Both of those guys are really, really good at what they do, and I'm glad they were on here.
That's going to do it for this week's show. As a reminder, you can help support Power Supply by subscribing on Apple, Amazon, or Google Podcasts. You can also find us on Stitcher, iHeartRadio, Spotify, or your favorite podcast application. We've also got bonus content for certain episodes. All you got to do is download our smartphone app for iPhone and Android. While you're there, we'd certainly appreciate a rating and a review because your feedback is important to the show. And on behalf of Gary Hayes and myself, thank you for listening to this week's episode of Power Supply.